you might be wondering what actually is mental health. Well, let me tell you. Mental health actually is a person's condition with regards to their psychological, social, and emotional well-being. It could affect how we think, feel, and behave. People sometimes use the term mental health to mean the absence of a mental disorder. There are many types of mental health such as depression, anxiety, eating disorder, PTSD, which is post-trauma stress disorder, and many more. There are also many factors that contribute to mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, as well as family history of health problems. You may know if you're having mental health by knowing the symptoms of mental health. Next, I will pass to Hani to talk further on the types of symptoms of mental health.
Hi, Assalamualaikum. One types of mental health is depression. Depression is one of the most misunderstood illness in our society today. People often claim that they are depressed because of their failed in relationship, unexpected changes in their life, and a minor tragedies. But this is miles away from the meaning of depression. Trying to determine whether someone else is different, even if you know that person well, is extremely difficult. There is absolutely no way on earth to see inside another human being mind. For example, some people are introverted. It can be hard to determine whether an introverted person is depressed because they are quite often and internalize their feelings. Another thing to keep in mind when a person starts behaving out of the ordinary for them, for example, a change of routine can have a variety of explanation. Someone who no longer goes out with his friend as often as before might be depressed and avoiding people or working longest hour or have new girlfriend. All of these are likely to be explanation. Next, I will pass to Azrin Nazira.
We already know one of the type of mental health, which is depression, that explained by Farahani. Now I will talk about the second type of mental health, which is anxiety. What is anxiety? Actually, we do facing anxiety in our normal life. For example, when we feeling anxious, waiting for something, such as waiting for medical test result, when we having problem, and many more. But it is different for some people who facing the serious level of anxiety, which is lead to worsen of worries for weeks, months, and years. This level of seriousness can be worsened until it's interval in the daily life. How do we know that we are exposed to the anxiety? So there are a lot of symptoms, which is nervousness, restlessness, being tense, increase or heavy sweating, trembling, and muscle twitching, also insomnia. So how dangerous anxiety can be is, it can be risky in the level of stress, emotional disorders, and the worst one is panic attack. As a result, people with anxiety or panic disorder, they may make frequency trips to emergency rooms or doctor offices. They may believe that they are experiencing life-threatening and have conditions other than anxiety. Next, I will pass to Sarah Aina to continue the other type and the symptom of mental health.
Okay, so the next type of mental health is post-traumatic stress disorder. So post-traumatic stress disorder is a mental health condition that usually triggered by a frightening event, such as probably they experience it or they witness it. The symptoms can come from flashbacks, nightmares, and severe anxiety, and also as well as uncomfortable thoughts about the incident. Post-traumatic stress disorder can be grouped into 4 types, which are disturbed memory, avoidance, negative changes in thinking and mood, and then changes in physical and emotion reaction. The symptoms of disturbed memory can be include when you remember repeatedly of the unwanted sad memories of the traumatic event, and it also can be when you start to have the flashback where you think that the traumatic event will be happen again in your life. For avoidance, it is when you try not to think or talk about the incidents or the traumatic event, such as you try to avoid some kind of places, activities, or people that reminds you of the traumatic events. Negative changes in thinking and mood can be shown as negative thoughts about yourself, other people, or the world, and it also can be included with when you start to feel about a long gap between you and your family or your friends. Changes in physical and emotion reaction is when you have a trouble sleeping or when you have a trouble concentrating, and also like being easily startled or frightened about something. So that are all the points that I can explain to you about the post-traumatic stress disorder. So next I will pass to Afif, where he will brief more towards the last type of mental health.
So, I will continue with another example of mental illness, which is eating disorder. So, what are eating disorder? Eating disorder are serious mental health disorder that involve several problems with your thoughts about food and eating behavior. You may eat much less or much more than you need. Eating disorders are medical conditions. They are not lifestyle choices. They affect your body's ability to get proper nutrition. This can lead to health issues such as heart and kidney problems, or sometimes even deaths. So, what are the types of eating disorder? Basically, there are the 2 types, the most known in type eating disorder, which is binge eating and anorexia. Binge eating is out of control eating. People with disorder keep eating even after they are full. They often eat until they feel very uncomfortable. Eating too much too often can lead to weight gain and obesity. In fact, the obesity rate in Malaysia is the highest in Southeast Asia. So another type is anorexia. Anorexia is a disorder that person avoid eating foods and eat very small quantity of foods because they may see themselves as overweight, even they are normal and not overweight. Basically, we can see this type of disorder in artists or model because they want to keep their body in certain weight and not overweight because it will affect their proportions. So, what are the symptoms of the eating disorder? There are 6 potential signs of eating disorder, which is exercise, preoccupation with feeling fat, abnormal electrolyte levels, intense fear of gaining weight, unusually large intake of food, and avoiding of eating. So next, I will pass to my teammate Rizman to explain how to overcome all this mental illness in our life.
So guys, how we can overcome this mental health issue? So the first thing that we can do is we can do exercise. Why exercise? This is because when we do exercise, it will make our body healthy. When our body healthy, it will produce the productive mind or the positive mind. Okay, so today I will show you a few exercise that we can do every day, and it is very easy to do at home. So let's do it. The first exercise that you can do is push-up. For beginner like me, you can do 10 to 15 push-up per day. The next one is sit-up. Sit-up also you can do 10 to 15 per reps. The next one is plank. Plank for beginner like me, I suggest you do 1 minute to 1.5 minutes. The next one is jumping jack. Jumping jack, I suggest you do 20 to 25 reps. The next one is lunge. You can do 15 to 20. Last but not least is high knee. High knee you can do 20 to 25, depends on yourself. Okay, that's all the exercise that you can do at home. If you think the exercise is not enough to you, you can increase your reps. Maybe from 5 you can increase to 10, or you also can add the exercise because there are many more exercise. You can find out yourself if you think it's not enough to you. Okay, that's all.
Next is spend time with family and friends. Having time with your family can positively impact and enhance your physical health with the right kind of activities. For instance, family who eat home-cooked meals together tend to have a better diet than those who don't. Plus, participating in outdoor activities like sports games, hikes, or gardening together helps to improve fitness. There's even evidence that time with family can boost the effect of exercise and other healthy habits. It improves heart, brain, hormonal, and immune health. So, spend time with families can encourage one another in order to maintain healthy lifestyle. Meanwhile, friendship can also have a major impact on your health and well-being. However, having a good friend is good for your health. So this is when friends can help you celebrate in good times and can actually provide support during your bad times. Plus, friends can also prevent loneliness and give you a chance to offer needed companionship too. Next, I will pass to Akila.
Thank you, Ain. So, I will continue on the suggestion of the activity that could reduce your stress problem. First thing first, I will suggest you to do something that you're really interested in. For example, personally, I love to do a gardening. Gardening could make you more closer to the nature and give you some stress-free and the feels of calm. Next, I would suggest you to do a drawing. It is where you could express your feelings into the drawing. At the same time, you could improve your memory and critical thinking. So I will pass this to Ada to continue about the suggestion on how to overcome the mental health problem.
I will explain the last point for this video, which is getting help for your mental health. Seeking help is often considered the first step to getting well and staying well, but we don't know whether, where, and how do we even start. Thus, it is common to feel unsure and insecure and to wonder whether you can handle things on your own. But it is always okay to seek or ask for help when you don't have any solutions for your mental health problems. The issue is now, when do you seek for help? Okay, firstly, you are worrying more than usual. Secondly, it is difficult to find pleasure in your daily life. Thirdly, having deep thoughts that does not have any solutions. I will continue my point with who can you turn to when you have a mental issue. Firstly, seek your trusted therapist. Consult and meet with the local or any trusted therapist that you can find and ask for help and solutions. Second, confide with your family, friends, or nearby housing communities. The last point, ask for help from your local mental health association. Okay, a friendly reminder to always look after yourself and monitor your mental health from day-to-day life. If things get out of hand, you can seek help from others because you are not alone. Do not turn blind on one's misfortune even if it's a mental problem. That is all for me. Thank you.
In conclusion, it's very important to manage our mental health because it cannot be cured with medicine, but we can manage through such as exercise, or share with your friend or family can greatly reduce the effect in your life. For example, people having chronic stress has unbearable effect in their overall health. Physically, it can contribute to migraines, ulcer, muscle tension, and fatigue. Canadian research found that chronic stress has more than double the risk of a heart attack. When we are mentally healthy, we can enjoy our life and environment and the people in it. We can be creative, learn, try new things, and take the risk. We are better to cope with difficult time in our personal and professional life. We feel the sadness and the anger that come with the death of a loved one, a job loss, or relationship problems. But in the meantime, we are able to get on with and enjoy our life once again. Thank you.